I'm Glenn McGinnis, and this is Outburst. On the program, do you feel optimistic about a slowing inflation rate?
I am optimistic about a slowing inflation rate.
I don't see an improvement coming anytime real soon.
I think government's doing what they can, the central bank's doing what they can.
We need a longer-term strategy for inflation to be kept under control.
Inflation is going to keep going for a while. I don't think we're there yet.
But first, now that summer is behind us, MPs have returned to Ottawa and are ready to get back down to business. In the roughly 2.5 years since a pandemic was declared, Canadians continue to face multiple challenges in their everyday lives. Higher prices on everyday essentials, a healthcare crunch, and lingering COVID-19 restrictions continue to be on the minds of Canadians. So we took to the streets to ask people what should be the first order of business for parliamentarians. Our question:
what should be the top priority for Parliament?
Yeah, in my view, the top priority should be health across the board, across all provinces. And I would really like the provinces and the federal government to get along and work out a system where healthcare services and is provided at a better quality than it is right now. I live in Quebec, so the situation is pretty dire there at the moment. And I see what's happening in the province, making promises right and left, but nothing for healthcare. So something's wrong here.
Yeah, I think certainly transfer payments for healthcare should be high in the priority, and climate change. I think that's super important. Yeah, those would be my two things, I think.
Accepting the newcomers, embracing them and giving them jobs, because the reality between them coming here and them finding jobs, there is a huge gap between that. People with jobs will be able to face the inflation.
Right? I speak for myself. One of the things is I was talking about the way for doing daycare, for example. Daycare is a huge thing that basically Ontario need to focus on also. And how we deal with every stuff going for the inflation, how things are going right now, it's pretty hard.
Well, we have concerns about inflation and what we do about that. I know everybody thinks we should raise interest rates to deal with it, but I think most of our inflation is not caused by that. Supply chain, demand, supply, those sorts of things. But clearly the government should talk about that.
Well, I think national pharmacare would be a very important thing to do. It would certainly do the most bang for the buck for people all across Canada. And I think that's something that they should look at. And even though my kids are grown, I think the daycare, the $10 daycare that they promised some time ago, the last election, they need to keep working on that and getting that going.
I think it should be the healthcare system. I think we need to do something for the doctors, the nurses, anybody in the health field, because they're overworked, they're overtired. There should be some kind of reserve employees to take over, because I had open heart surgery 1.5 years ago, and I could see how tired the nurses were then, so I can imagine now they're just overwrought. So I think that would be the top priority.
I think, honestly, the healthcare system is what needs a lot of work at the moment. With the opioid crisis and, just inadequate, support nets, I guess, for those who can't access healthcare. Homeless people, for example, it's impossible for them to get dentist appointment and actual rehab for months.
Making sure that seniors have family doctors, that's one of the most important things. I think it's been really difficult for people to find a family doctor. And with the crisis currently, as a result of a lot of what's happened with COVID, I think the system is in crisis mode. So we need something very drastic, and we have to think about seniors, of which I am.
Well, I think they need to make sure that we've got COVID put to bed. And other than that, the cost of living, the economy, I think that needs some work on that to get that to recover.
I think the state of world affairs should be really important, given that some days I wonder if we're on the verge of a third world war with the tensions, the geopolitical tensions. So I think that that is impacting strongly on everything that takes place in the country, whether it's the economy or the security of all Canadians or how we're moving ahead as a society. That is a pall over the world right now, I feel.
And as a Canadian, I think that's the foundation part of our governance, is our ability to support each other in our healthcare. So I really think, for me, fundamentally, that's the most important thing right now.
If you can't afford to live, you can't afford to live. I mean, inflation hurts everybody, right from, well, mainly the middle class to the lower class. You'll see less people out and about because they can't afford to be out and about. So yeah, inflation.
Getting rid of fossil fuels and just going green, like with finding other alternative solutions for fossil fuels.
To me, it would be free up our borders. Our borders are not open to the unvaccinated, and that again speaks directly to our freedom. We're not a third world country. We have a choice, be vaccinated or not, wear a mask or not, and our freedoms, I think, are in danger just by the fact that the unvaccinated can come in freely to Canada. That would be my answer.
Our universal healthcare system, while long a source of international pride, is not without its problems. A recent poll by the Angus Reid Institute suggests that roughly 9 million Canadians have chronic difficulties accessing healthcare. Doctor and staffing shortages in big cities, small towns, and even remote communities continue to be a stress on our hospitals, on our healthcare professionals, and on patients. We sent our cameras out to ask Canadians how we can find viable long-term solutions on easing the stress for our doctors and nurses. Our question:
what should be done to fix healthcare in Canada?
I'm not sure I'm qualified to even address that issue. It's a big one, but I think there needs to be more effort put into the resources that that we provide our medical folks to get their job done. We need to find a way to increase the number of doctors and nurses and PSWs that we have trained in the country, and I think part of that is allowing people from other countries to come that are qualified. We need to find a way to get them certified to help us out.
I think one of the things that could be done is interprovincial recognition of credentials so that healthcare providers, whether it's doctors or nurses or other specialists, are able to work seamlessly between the provinces. And also that recognition of foreign credentials be a priority so that people who are coming into the country who have great skills are not saddled by bureaucracy that doesn't allow them to contribute the way they can and are able to Canadian society.
Healthcare is what Tommy Douglas started for us. It's a large part of why we're Canadian and what makes us such a great country to live in. So I really think finding the funding to do the things, and I think it's a lot more than funding, it's finding a way to treat the people better, to make it more attractive for nurses and doctors and people to stay in our industries. That's really where I feel the most important thing is, and I think it's a funding issue, largely, but not only.
Like, it's just steady work, and it's work, and that's their life, right? 36, 38 hours, things like that, it's got to stop, right? So, and that's where you get your mistakes.
Because I think there's a misconception that we all have that it's free, and it's not free. And I think we need to sort of come to grips with that we all, through taxes, pay for this. So there's a lot of times, emergency rooms as an example, where people just go to the emergency room because they have a cold. So I think people need to understand there's a cost to doing things like that.
I know the public-private debate is a big one. Maybe some level of privatization could help with those problems.
So, I mean, the fact that it's happening in virtually every province and territory simultaneously means that it can't be pinned on one provincial government, or there seems to be some systemic issues. So I think there's better dialogue needed from the federal and provincial leaders at all levels. What those solutions are, I have no idea, but it's more than just pointing finger at conservative provincial government or liberal provincial government. burnout, certainly during the pandemic. We're seeing that people aren't returning to jobs. They're going on long-term stress leave. Investment in actual training and recruitment of physicians and nurses and other healthcare providers. I think all of these have to be looked at, but not just from a lens of it's a province's problem. I mean, it's a Canadian problem, it's a federal problem, it's a provincial issue.
We need to streamline the education, open up more seats. My husband here is a very highly skilled nurse in Germany and Europe. He cannot practice here. And it's been a total nightmare trying to get him qualified and licensed in British Columbia.
It's very hard for people from nurse people from outside. I'm from Europe and I'm nurse there, but here is very hard to be. I have to study again here actually to be nurse, but I have a 6 years experience in Europe in surgery department.
We have taxi drivers that are doctors and nurses that are working in grocery stores and things like that. Well, let's find a way to make those guys being able to use their craft here, because they've gone through all the education that they've needed in their own countries. So of course, for sure, we could bring them up to par with our own standards. It would be very easy.
I think we're very lucky compared to the States that we don't have to pay for it. It's unfortunate that we stopped the payment of $75 a month because then COVID happened. I think we would have really needed that extra money then.
Like for the work that it entails and like the level of education that you need to afford and pay for, it could definitely use with a bit more of a salary or benefits increase.
I guess it comes back to the COVID thing, man. It's really how they determine how they're going to handle COVID procedures. Like they overworked all the last medical, all the medical workers that were working before were burnt out because they didn't put them in the proper situation to handle the pandemic. So that made a lot of people leave. They were burnt out, they were done, they couldn't handle it, so they left. So once again, they just got to figure out how to make it work for not only the citizens of the country, but for the essential workers that are here to take care of everybody.
I wouldn't be as afraid as a lot of people are about mixing up private and public. I think it's got to be done, and the fact is it's being done. You could get a hernia for 40 years in Ontario way quicker from the private clinic than any hospital could ever do. And I think that's inevitable. Every other country has got it. We have to do that with the safeguards that are necessary.
Too much centralization takes services away from people. So we need to bring back services to where people live. At the local hospital, for example, at the healthcare unit, in clinics and stuff like that. It's not by bringing everything to the center that really works, because it's not working now and it won't work in the future.
I think we probably need to increase taxes so that we can allow, it feels like it's going towards a two-tier system. And I think we need the wealthy to pay more taxes and just have it more accessible for everyone. I think COVID has proven that our system is quite broken. So I think we need to put more money into the system instead of less.
How many Canadian prime ministers served during the 1980s? 2, 3, or 4?
3.
3.
Oh gosh. I'll go with 2, but I'm really not sure about the answer. 3.
3.
Is it 3?
I'll go 4. Let's do 4.
The answer, 4.
Woo!
You can high-five each other.
Nice.
Very good.
During the 1980s, 4 people served as Prime Minister of Canada: Joe Clark, Pierre Trudeau, John Turner, and Brian Mulroney. Following the defeat of Joe Clark's short-lived Progressive Conservative minority government in the House of Commons in December of 1979, a general election was called for February 18th, 1980. The Liberal Party of Canada emerged victorious, making Pierre Trudeau the second Prime Minister of the new decade. After Trudeau resigned as Liberal leader in 1984, he was succeeded by John Turner, who was Prime Minister for just over 3 months. Turner called an election for September 4th, 1984. It resulted in an historic landslide victory for Brian Mulroney's Progressive Conservatives. Mulroney would be Prime Minister from 1984 until he stepped down in 1993.
Earlier in the show, we spoke about priorities in Parliament and our highly stressed healthcare system. Climate change is another topic that many people find most important. According to National Resources Canada, this country is warming at twice the global rate, and the impact is predicted to be catastrophic, especially in the north. But at the same time, many Canadians are dealing with a higher cost of living and other issues brought on by this pandemic, which could leave climate and environmental issues down the list of priorities for them. So we took to the streets to ask Canadians this question.
How important is the climate change issue to you?
Very important, because we are living in a world where you wake up in the morning and all the weather is not right, and we have flood, we had heats, we have fires, and the people are drowning in their houses. We had a lot of flood traumas just in the Ontario River, Ottawa area already, and we had Vancouver fires, we had Vancouver floods, and it's gonna continue like this for a lot of time if we are not going to change the ways we are dealing with climate change.
Well, on the one hand, I'll say I think it's enormously important. On the other hand, I'll ask myself, what are the things that I'm doing? And we're getting away with a lot here in Ottawa. We can kind of live a normal life and watch the rest of the world evaporate or burn up. So it's very important. And the government needs to understand there's more resolve out there to do the hard decisions than I think they've felt. But I don't blame them for backing off when you get the loud voices, but it's pretty clear it has to be done. And it's going to hurt. It's really going to hurt.
Climate change is very important. It is very, very important because obviously we don't know the full impact. We hear the things online, on the internet. We see the movies that depict what it would be like. But I still don't feel like people are being active or proactive about it. So
I think it's a global issue. I think it's desperately important. You know, we've got children, we'll be all right, possibly. But, you know, look at the change in the weathers, the hot, extra hot summers. I think you had a very hot summer last year. I don't know if this is seasonal for you, but it's pretty hot here. And it's been very hot in the UK, which we're not used to at all.
In Europe, the forest fires and fires in California and all throughout the world are causing devastating havoc, as are floods in places like Pakistan and drought in other areas. It's just everything seems to be off kilter, and I think that there's no denying that climate change is a reality that we all have to come to terms with, and that means now, not 20 years from now, because I don't think there'll be much left if we delay much longer.
It's extremely important, and I think the climate change, if you want to use that label, there's different labels to put on it. It's critical to our survivability in the long term. And quite frankly, it really concerns me the reaction that many people take with the populist movement, the misinformation, to not accepting the truths and actual facts of science. It's critical, and it's really important. Yeah, high end for me.
Now I'm old. It's not at the top of my list, but I do have kids, so it's fairly important, yeah. I wouldn't say it's utmost, but fairly important, yes. If you don't have Earth, you don't have life.
Very important. I got 3 grandchildren who's certainly going to need to have a better world to live in when they get older. So it needs to be something done drastically about climate change.
How about you? To me personally, it's changing the world big time, and I just came back from Tuktoyaktuk up in Northwest Territories, and the permafrost and everything up there is just being destroyed, and polar bears and the whales and everything, and they look at it that way, and the effect on these people, and also like even, hey, the weather we're getting here in Newfoundland, it's unbelievable. I love it, but we need rain. So it's a very, very important thing, myself personally, right?
Well, what climate change? You wanna see climate change? Staying right here for 2 hours is going to change.
Very important. Very important. I have children who are, from 20 to 30 years old. Hopefully they someday will have children, and I think we need to figure out how we're going to address the problem so that we have a planet that people can live in, that my children can live in, that their children can live in. I think it's a huge issue.
Oh, I think climate change is very important. I mean, you don't have to go very far to see, how in the north, how all the, even like the ice flows and that are just diminishing, and with all the heat domes and all this, it's just all culminating, and we're getting to the tipping point. We've got to do something to stop all the emissions for fossil emissions, and find new ways to improve, and whether it be wind power or solar power or anything green emissions. We got to get better at it.
Oh yeah, it's really important to me. I've heard of, there was this conference last year, I forgot the name right now, but I'm glad that we have plans for, I believe it was 2030 or 2050, and I'm really glad that Canada is part of that conference, and part of the countries moving forward to deal with climate change, of course. And we're in a crisis right now where, talking with my friends, they're usually like, yeah, the individual work doesn't really count when, the mass isn't really working towards ensuring that those changes are happening and maintaining that routine. So it's definitely a crisis that's going on, and we definitely should be still trying our best to maintain and keep moving forward, and
Recently, inflation has hit levels we haven't seen in almost 4 decades. For day-to-day essentials, Canadians are paying 10 to 15% more than we were just 2 years ago. Over the summer, we saw a slight drop in the inflation rate and a modest drop in the price of gas. With the intent of beating inflation down, key interest rates were raised 75 basis points, which means it will cost Canadians more to borrow. So we took to the streets to ask people if they feel the cost of living will become more manageable as the Bank of Canada continues to beat that inflation trend down. Our question:
do you feel optimistic about a slowing inflation rate?
Yes, I trust we have the smartest people working for us at the federal bank, and they've made some severe and drastic rate hikes to theoretically curb this inflation.
No, I think we're in for it for the long haul here. I think we're probably going to get inflation's going to keep going for a while. I don't think we're there yet. I think we're going to interest rates are going to climb, and if interest rates go up another couple percentage, it'll do two things. One, that'll help slow down inflation, but the other problem, it'll hurt construction industry, because down goes the our kids are not going to be able to afford homes, and so it's a two-edged sword, right?
On the other hand, so many people aren't being paid enough. Lots of articles about the gig economy and how terrible that is, and that's going to mean the rest of us are going to have to pay more for those goods and services. So I hope it's going in the right direction.
It's not a big concern of me. I think in the short term, things will slow down, and we see what the Bank of Canada is doing, increasing interest rates. So that should lower inflation expectations, I think. And we see changes like in petroleum and in food. And so I think in the short term we should be okay. There's no cause for alarm, and there's no reason to put tons and tons of money in the pockets of people to say, because people are just going to spend anyways, right?
I feel a little concerned about the interest rates jacking so quickly. Like, I'm afraid people might lose their homes. On the same token, though, I think we needed an increase because house prices were out of control. And again, for for my kids. You worry that they'll never be able to afford a home. So I think I'm optimistic, but it's also a little nervous. So I think it could go either way.
I am optimistic about a slowing inflation rate. I think we're probably hammering too much on interest rates. I guess it's the only tool we have, but it's like taking a sledgehammer to kill a mosquito. In time, the supply chain issues, the demand supply issues, they will sort it out. I'm sure we'll get back to a reasonable inflation rate. I guess the question is, we long accept that 2% is the right rate. Maybe it should be 3 or 4%, because that doesn't give the Bank of Canada much room to move on interest rates. But I am optimistic. It's coming down. It'll continue to come down, I believe.
Well, I'm not an economist, but there may be some signs. You know, the price of gas in our area went down a little bit, so maybe things are going to turn.
Yes, I do. I think that's possible. I think that making sure that all citizens have a roof over their heads and some work to do, and that our system allows for every Canadian to be protected from food insecurity and the like is important. So I do think that it's in the power of the government and the private sector to work together to help reduce the rate of inflation.
I think government's doing what they can. The central bank's doing what they can to bring it down. But I think we'll get there. But I think there could be a lot of pain along the way for consumers.
I'm no economist here. I feel like, as far as what I know, you know, I guess the biggest litmus test from where I stand is like just seeing housing prices and housing becoming an investment. So I've seen that cooling, so I'm optimistic that we're starting to do something, but I think that there's more than like a onesie-twosie approach. Like, we need a longer-term strategy for inflation to be kept under control, because soaring food, like here in Newfoundland and Labrador, food prices were always expensive, and they're exorbitant now, and it's just been being jacked up even more. So am I optimistic? Cautiously so, but I think we need more sustained changes, more than just the housing market.
Thanks for watching this episode of Outburst on CPAC. If you have any comments about this show or any other show, you can find us on social media. You can also find us on our website at www.cpac.ca. I'm Glenn McGuinness, and on behalf of my colleagues at the Cable Public Affairs Channel, thanks for watching. We'll see you next time.